Cancer is the #1 killer in Nebraska. The fact is that we feel it's time to do more to attack this problem. The idea is to develop a comprehensive cancer center that combines patient care with research and academic teaching. By doing that, we think we can attract the best and the newest and best programs, both for care of patients and for research. It gives Omahans and those in our region an opportunity to be treated in an environment that gives the finest and newest of facilities together with the best teachers and the best academics and the best patient care. I think the facility, together with the programming that's inside it, will be very much in line with our motto of serious medicine for a very serious disease and extraordinary care.
Well, I think the public-private partnership that's been built around this cancer center is one of the most exciting projects I've ever been a part of. When the state government stepped up and 44 votes in the state legislature and the governor supporting it, that was a very strong commitment from the public sector that we need this cancer center. And then the city followed the same way and the county followed the same way. Omaha is one of the unique cities not only in the United States, but the entire world. The private sector in this city is virtually unmatched in my estimation. The people that Helmore has brought to this campus, the talent, the brains, the passion and commitment that they have really elevated the medical center in a significant way. And the same is true with Glenn Fosdick in the way he has built the hospital into one of the best in the nation. It makes the private sector's job and the public sector's job much easier in saying, my goodness, let's get behind this. And the big gifts that were given, especially with the Buffett contribution of Pamela and Fred Buffett, wow, that really brought the people together, and I could just go on. The public trust isn't going to come to a project that's built on quicksand. Because of the people involved in the medical center, this project is built on reinforced concrete.
This is a compelling project. It's the right time, it's the right place, it's the right people. I'm filled with admiration and gratitude for the wonderful people who are leading this project and working in it. And we have the energy and vision of Hal and Beverly Moore and all they bring to this project and this institution. We have the incredible energy and community engagement on behalf of Mike and Gail Yanney and the trust the community has in them mobilizing such incredible support across our community. Teamwork has been a hallmark of the University of Nebraska Medical Center all through Dr. Moore's tenure. And I'd expect that teamwork to be culturally part of what the success will be in this cancer center. This is classic give it back, pay it forward. People in future generations. This is powerful for the patient, not only the patient, but the patient's family. And it's just a project that has a lot of upside. And so it's a wonderful thing to be a part of it and a great opportunity. This is a special project at a special time with special leadership attached. And there are so many who have brought us this far, this fast.
When we look at priorities university-wide, I look for areas where we can make a huge impact. I look for areas where we have built over a sustained period of time great strength, and certainly that is the case in cancer research and in the clinical treatment of cancer at the medical center. So this is an obvious area for us to make an investment. The organization here on our campus is really possible because of the marriage of two great Nebraska institutions, Clarkson Hospital and the University of Nebraska Medical Center. And this has taken us to a position where now we have a hugely successful healthcare and research enterprise, of which cancer research, prevention, treatment has been an enormous part. It will only be more important in the future. There's been a tremendous amount of momentum. This is the right time for us to capitalize on that, to continue the momentum that has just been phenomenal over the last decade or so. To make a major investment today to pick an area where we say we are going to be among the best anywhere in the world, this is a logical place to do it. This is a place where we have great strength. It's a place where if we make additional significant investments, we can be among the best anywhere. I think this is an area where we have an opportunity to be among the best, and I think we're seeing that happen today.
I'm a second-time transplant recipient of both bone marrow and liver, and I'm doing very well by both. I probably was one of the first 1,000 people in America that had a transplant back then, and as a result, you want to go someplace where they have an expertise. It being that unknown and that new, I came here, and it's been a major part of my life. I'm certainly not shy about why I came here. I'm not shy about the care I got here. We've had friends and family who we've referred to UNMC, who also have come here and under duress at other hospitals found cure here. You hear a lot of other hospitals around America that sound like they're better and sound like they can do, everything that's expected of them. And then you come here and you witness that. This hospital is so special. It's, I think, very unique. The community at large is very unique. The new medical center that's going to be built is going to be a world-class and one of a kind. Brick and mortar is one thing, but it's not about the brick and mortar. It's about the people behind the scenes. It's about the software, so to speak. Not the hardware of walls and ceilings and floors, but it's about the people behind the scenes that put all those things in motion that save people's lives.
The cancer complex will in itself be transformational for the hospital and the university, because it is the first integrated project that we've really had together where patients, clinicians, nurses, pharmacists, and researchers are all located in one facility. Having the information also available through the scientists working in the same facility to understand at the true molecular level for each cancer what's driving that person's particular cancer, and how do we develop a new therapy specifically that only will be precise for that patient. Everybody's facing the same issue in terms of how do you integrate the science of cancer with the care of patients. We know that the best way to accomplish this is to have close interaction on a daily basis between the scientists and the clinicians and the patients. We're very fortunate. We have a physical space on our campus that we could create a new cancer complex that's totally integrated with our hospital system, but is also totally integrated with our research community that's also surrounding it. Suddenly you hear about something that went on in the laboratory that may have a true meaning for your particular patient that you saw today or yesterday, that you wouldn't have thought about if you hadn't bumped into that person today. It'd be a great place to take care of patients, and it'd be a great place for scientists to work on things that really have an impact on cancer care.